each week we talk to doctors who swap their lab coats with microphones to talk with us, give us some health tips. Sometimes they keep it simple, sometimes they make it smart, and sometimes they surprise us with a lot of health info that we don't have. And of course, where it comes to health, where we go first matters, whether it's the hospital, the doctor, or the right care. Today we have Dr. Rajesh Parasnis with us, who is the Program Director for the Center of Excellence Spine Surgery at the Ruby Hall Clinic, Pune. Namaskar.
नमस्कार सोनाली.
Welcome to the podcast.
थँक्यू सो मच.
When we talk about spine, मला सगळ्यात आधी मराठीमध्ये आपला मणका किंवा कणा आठवतो हा शब्द, आणि कणा म्हटल्यानंतर we all Maharashtrians relate with
कुसुमाग्रजांची कविता.
the poem. Do you want to start with that? Do you read poetry?
Of course.
Are you fond of it?
We are fond of it. बेसिकली मी मराठीतनं शिक्षण केलेलं आहे.
अर्थात.
मराठी कविता लिहायचो. आणि
वा.
कुसुमाग्रजांची कविता ही आय थिंक मोस्ट ऑफ महाराष्ट्रीयन्स आर इन्स्पायर्ड बाय इट.
Absolutely.
आणि त्याचा माझ्या स्पेशालिटीशी फार जवळचा संबंध असल्यामुळे तर मी कधीच विसरणार.
Is it like your favorite? कुठे कधी काही
मोस्ट फेवरेट. व्हेरी इन्स्पायर्ड.
इन्स्पिरेशन हवं असेल, मोटिवेशन हवं असेल, वेन यू फिलिंग अ लिटल लो, एखाद्या अवघड सर्जरीच्या वेळेला कधीतरी आठवतं पाठीवरती हात ठेवून लढ म्हणा?
3 आठवड्यापूर्वी
हा.
आमची खूप मोठी एक सर्जरी होती आणि म्हणजे पूर्ण टीम मध्ये 2-3 जे ज्युनियर्स होते त्यांना इन्स्पायर करायला मी हीच कविता सांगितली.
Oh, so you use it on a regular basis. Wow. For people who do not know, please, after this podcast, go check this out. It's one of the most inspirational poetry in Marathi literature ever. And on that note, I think we'll start with the topic. Of course, you must have realized we're going to talk about surgeries, stuff, everyday things related to spine. When we speak about spine, the first thing that comes to you is posture. They say maintain a good posture. Everything starts from there. What is a good posture?
Okay. Good posture is the position of your spine in entirety in relation with your whole body also, which produces the least deleterious strains. So it helps you to be more efficient, reduces anything which can result into pain,
Right.
further wear and tear or degeneration, or result into any kind of later day problems like stenosis, spondylosis, etc.
Okay.
So in everything that you do, sitting, standing, working, sleeping, there is something called as good posture, which is the more or less ideal positioning to perform that activity.
And can you demonstrate
Of course,
literally
I can-
की काय असलं पाहिजे, right correct
जरूर.
posture for your spine health?
आत्ताच बघायला गेलं
हा.
तर I love the way you're sitting,
Okay.
upright with
Yeah.
proper postures, squared shoulders,
Yeah.
straight back, tummy tucked in, proper use of the chair, right? आता मी जर विचार करायला गेलो तर this is not a good chair for me
Okay.
because it's a little lower to my height.
Yes.
Second thing is I like firmer chairs with a little higher backrest
Okay.
with a proper angle for my elbows. त्यामुळे तुम्ही कुठली चेअर वापरता?
elbows.
Yes.
I thought it was
This is
more
little-
about just the knees.
No, it's about everything.
Okay.
Why the knees? Because the height of the chair should be equivalent to the height between your heel to your knee.
Okay.
So if
So-
you sit,
Mhm.
your thigh has to touch the chair.
So 90 degree मध्ये proper it should land.
90 to 100. It should not be too low or too high.
Okay.
This is about the height and the knees.
Right.
Second thing is about the distance between your back to your knees.
Mhm.
If the chair is too shallow, what happens? Your knees are jutting out.
Yes.
There's too much strain coming directly on the back and not getting into the thighs.
Right.
And too wide is also not good, कारण त्याच्यामध्ये होतं असं की मग तुमच्या काफ आणि चेअर मध्ये जर डिस्टन्स राहिलं नाही तर जास्ती स्ट्रेन मग तुमच्या बॅकवरती यायला लागतो.
Okay.
हाईट फ्रॉम युअर हिप्स और थाईज टू युअर back support is also necessary, to your hand support is also necessary. So always choose a chair with hand support, but the height of the hand support should be such that your elbows and shoulders should not be very strained.
Okay. So this is right.
This is right for you, a little too high for me.
Okay. I think Ruby Hall should give me this chair, है ना? ही माझ्यासाठी परफेक्ट आहे. पण we are talking about sitting positions, कारण की a lot of today's generation, I would say 30s, 40s, middle age, young to middle age, we are facing a lot of challenges कारण की most of our workspace involves a lot of sitting. So a lot of sitting hours, whether it is driving or working from home or from the office. So this includes a lot of sitting down in one place and working on your screens. And a lot of people who are not working are binge watching TV at home, watching screens at home. So most of our lives, if you're not working out or doing a physical activity, you're just sitting. So how does that impact your spine?
It impacts usually the spine. As you know, there are very few species on this planet which are bipedal. Human beings progress because we started walking on two legs, and that is because we used to run, we used to walk, we used to hunt, we used to start doing agriculture activities. आणि आपण ते सगळं सोडून आज बसायला लागलोय. त्यामुळे थोडक्यात सांगायचं झालं तर इव्होल्युशन टेक्स thousands of years to develop your body parts. We are in a short duration have started using your body what it is not meant to do. Sitting for 12 to 14 hours a day produces too many strains in your lower back, in your neck, in the other parts also, which result into disastrous consequences. You start getting slip disc, degeneration, wear and tear very fast in life. मानेमध्ये आणि कमरेमध्ये सारखा बसण्यामध्ये जो लोड येतो त्याच्यामुळे मोस्ट ऑफ द टाइम्स त्याचे साईड इफेक्ट्स होतात. त्याच्याच बरोबर तुम्ही जर खूप फिट असाल, व्यायाम व्यवस्थित असेल, पोश्चर सांभाळलं तर एवढा प्रॉब्लेम येणार नाही. मध्ये मध्ये ब्रेक घेतला, प्रॉपर चेअर वापरली तर एवढे जास्ती प्रॉब्लेम्स येणार नाहीत. पण फार कमी लोक याची काळजी घेतात.
राईट, मी तेच विचारणार होते, हाऊ डू यू ब्रेक दीज हॅबिट्स? सी, वर्क एन्व्हायरमेंट मध्ये यू डोंट हॅव अ लॉट ऑफ ऑप्शन्स. So how do you still try to balance and break the habit?
No, interestingly, there are a lot of companies, because of the sort of legalities in Western countries, have started taking care of your workstation.
Right.
They will provide you with the right chair, right kind of table height, right kind of monitor. पण आपण काळजी घेतली पाहिजे. Frequent breaks every 45 minutes or half an hour. Getting up, moving around a bit, changing the position is absolutely mandatory. When you sit, take the chair closer to the table.
Yeah.
Don't hunch.
Yeah.
So the thing is, when you are
exactly.
So when you're using a chair close to the table, first of all, put your elbows.
Yeah.
Keep the back supported. Put your elbows on the handrest and see on the table. The angle should be close to 90 degrees.
Yeah.
If it is like this, it is
when
not
you're slouching.
Good. So first is you adjust your posture, adjust your workstation, then only start working. Second thing is binge use or marathon hours. That is just not good. The best of the chair in the world is not going to help you if you start sitting for very long period without a break.
We love binge watching. We watch all our shows in one go. No. Absolute no.
It is only good for a spine surgeon who is going to treat you in future.
Okay. See, we are not trying to promote that. We are trying to promote how you do things at home right.
Develop good habits. Have proper posture. Work on your fitness. Do regular exercises. Take frequent breaks. Make sure every 45 minutes an hour, get up, move around, walk. Remember, human body is meant for walking.
Right.
It is meant for doing activities, not to sit at one place. So fine, all of us are overworking. All of us are doing lot of activities every day.
You have to sit down for your consultations, OPDs.
For hours sometimes.
Yes. How do you manage?
I have designed the system in such a way that I don't sit in one chair.
Okay.
I have 3 to 4 cabins.
Okay.
So between every 2 patients, I have to walk.
Oh.
Most of the time, I'm standing. I'm examining.
Right.
I have an excellent team which looks after the other paraphernalia. So together, if I see how many steps I take to 50 to 60 patients a day, it is substantial number of activities. But I have designed this knowing what is the bad effect if I keep on sitting at one position.
So you have to do it for yourself. तुम्ही मगाशी म्हणालात, a lot of Western countries are now trying to build a nice, healthy, ergonomic situations for their employees. But unfortunately, आपल्या देशामध्ये अजून तितकं अवेअरनेस नाही आहे, and not all the companies can afford and are aware enough to introduce such I would say luxuries for the employees. In that case, we will have to step up आणि आपल्याला आपली रूटीन आपलं एक सेटअप करावं लागेल for us to not get into a situation where you will have to meet a spine surgeon.
Absolutely, Sonali, but that's where Indians are smart. We know customization. We call it jugaad, right? So how do we do it? Suppose you are going to have the same chair.
Yeah.
I can easily place a pillow and raise the height.
Yeah.
I can place a pillow behind and use it like a back support.
Yeah.
I can customize things. I can adjust as per my need, my stature, my posture, which is very well possible.
Of course.
There are just a few things that you have to be aware of, and all the time be focused on your health.
Right.
The health is the most important thing in life, not just the work and the returns.
Yeah.
नाहीतर मग आपण हेल्थला सेकंडरी इम्पॉर्टन्स दिला की all the problems will.
And that's what we are trying to do from this podcast, ki till it gets bad and you need to go to a doctor, तोपर्यंत वाट बघायची गरज नाहीये. You have so many little things, mindful things that you can do before you need to see a doctor. And that's why we are seeing people like you who are giving us these health tips. I never thought your elbow positions would be so important to determine your spine health. So that is a great tip so far. जे मला कदाचित मी कधी इतका विचार नव्हता केला की that would also determine it. For me, it was always about the lower back posture and your knees. So that's a very good tip. Apart from the postures and the chairs, let's move on to mattresses. कारण झोपताना while we sleep and while we are in the sleeping position, खूप लोक म्हणतात the mattresses are very important. There are a lot of brands out there who are trying to sell their products with the coil, असं असायला पाहिजे, तसं असायला पाहिजे, किती सॉफ्ट असायला पाहिजे. What would you recommend? Is there a particular type?
Yes, I will tell you the requirements. Type one can decide based on the availability and affordability. The fact that so many big brands are there itself is a confirmation that it's a profitable way. Why? Because it's so important. People who really have the resources won't mind spending on it because it really matters.
Right.
So what kind of mattress you need is something which is firm, which gives you good support while sleeping to maintain the natural curvatures of your back.
Okay.
If the mattress is too soft, your lower back tends to sink in.
Yes.
Because most of your body weight is here.
Right.
In the chest, it's all air.
Yes.
So most of your body weight is in the back, lower back, which sinks in when you are lying supine, and which requirement is exactly opposite. Because the lower back has a forward curvature if you see anybody walking. So you need a firmer support, which is usually provided by either memory foam or a combination of coir with U-foam or memory foam. So these are firm mattresses with good amount of support.
Okay.
There are many ready-made available. One can get customized. There is no need to go for a very, very high-end mattresses.
Yeah.
There are mattresses which are in lakhs of rupees also.
I'm sure, yes.
Yeah, but anything which is sufficient for your purpose, a good memory foam, firm coir plus U-foam is good enough. How to test it? Just sit on the mattress and get up. It should not leave behind a depression. It should come back to yes, too soft a mattress.
Yeah.
What you find in very high-end hotels are not good for your spine.
Right.
They may feel comfortable.
चांगल्या 5-star hotels
right. And सकाळी उठताना back pain किंवा stiffness येतो commonly.
Right.
That's why you need firmer mattress.
Okay. So not too firm, not too soft, right in between.
Yes.
Okay. When it comes to spine health, आपण back बद्दल बोलतोय, आपण posture बद्दल बोलतोय, पण the most important aspect is the neck. So, how do you determine red flags काय आहेत तुमच्या neck position मध्ये? Especially, I think working posture मध्ये, when you're working on a desk, a lot of people ignore how they use their neck. Rather, इतकी awareness नसते की your neck should be also in a particular position. मग काम कधी करणार एवढा विचार केला तर what are the red flags?
The red flags are the symptoms that a doctor will tell you that you have to consult when these things happen because they indicate something serious inside.
Okay.
So what are the red flags for the neck? The persistence of the stiffness lasting more than a few days. Every time you get up in the morning, there is pain and stiffness. The pain not just stays in the neck, but it can radiate down to the shoulder or into the arm.
Yes.
Along with the neck pain, you start getting tingling or numbness in the hands.
Okay.
Sometimes the legs.
Okay.
Sometimes with the neck pain, you also start getting headache, giddiness, or imbalance in the gait, and very rarely reduced strength in the arms and legs. These are the red flags that you have to immediately consult.
Okay.
The problem with the neck is all the time, most of the activities that we do, work or even your hobbies, is by looking down. And the commonest nowadays is your small screen.
Yes.
If you're mobile, and that's a disaster for your neck health. So all the time looking down produces strain on the discs of the cervical spine of the neck, which tends to cause more degeneration, wear and tear, and resulting into slip disc, neck pain, nerve pain, and stenosis, etc.
The screens are a big issue. In fact, now it's I think it's growing in younger people also. Children are also being diagnosed with posture issues, neck pains, back pains. At this age, screens are the problem?
Absolutely. If you see the statistics in India, more than 50% students have neck or back issues now.
Yeah.
And most of the time it's the posture.
Yeah.
When you're reading, when you're writing, when you're paper writing, when you're studying,
Mm-hmm.
which is also pertaining to the same posture in your work style.
Right.
Where if you're related in IT or otherwise, because most of us are using computers,
Yeah.
most of us using. So
Desk.
what is the important thing? When you're working on a computer, the screen, your monitor has to be at an eye level.
Yeah.
At the most, making a degree of 10 to 20 degrees downward.
Okay.
Not too high, not too low, a comfortable level, the distance appropriate. Otherwise, you'll try to crane forward
Yeah.
and do not use laptops in wrong positions.
Okay.
Always use it like a desktop. Keep it properly. Mobile also has to be at an eye level and not continuously. Most of the students who try to hunch forward, look down all the time and write for hours and hours. That's not a good thing. They need to take frequent breaks. You know, the older days, they used to have these inclined desks.
Yes.
Those were ergonomically appropriate things,
Yeah.
but we give up all the good things just because they are traditional.
That's pretty sad. I think we should consider all these things back. Currently, students, of course, the desks is also an issue. Daftar, the bags, the school bags that they're carrying so much of weight, that also leads to early spine-related issues in children.
Absolutely. I'm surprised sometimes children who are just 11 and 12 years old coming with back pain and trying to find out why that is happening, not because of any serious issue, but just because carrying heavy loads.
Yes.
Of course, we do expect children to be strong enough to do that, but in case somebody is not, then it creates issues.
Right.
So what are the ways to manage it? I always tell this to parents, and sometimes I have even suggested to certain school authorities, give them lockers. Don't carry the notebooks and books every day to and fro.
Unless there's a homework, why do you need to bring it home?
Exactly. Minimize the load. Second, if you have to carry, use trolley bags. Don't carry it all the time.
Right.
Change the positioning.
Right.
So make certain habits or provisions so you minimize the strain on your neck and back.
These are such small things and available options in the market, so they easily ho shakta. Overall, towards the end, whether it's for the children or for the IT professionals or people like us, we also have little posture issues. But when it comes to dancers, actors, and athletes, we kind of maintain and work and have a proper workout regime, which includes make sure that we have a good posture even while working and otherwise also. But आमच्यासारख्या लोकांना ज्यांना थोडंसं अवेअरनेस आहे त्यांच्यासाठी नाही, पण people who need a little bit of a tip, like we always say, what would you like to say towards the end? What kind of exercises or what kind of small habitual changes that you can make to sum it up again, so that you don't need.
So to summarize, one thing you already said, Sonali, health awareness is most important. Put a premium on being healthy and fit. You're not born just to work and earn and leave it behind.
Absolutely.
Second thing is, if your posture is good, you can prevent so many things. Prevention is better than cure in healthcare. So most important thing is proper posture, along with that regular exercises.
Yes.
And for the back and neck, stretching, something like yoga, and core strengthening exercises to strengthen the muscles which support your spine. These are the most important things.
Yeah, so that you not keep putting all the load on the spine.
Exactly. So if your muscles are strong, chances are very less that you will develop a serious degenerative condition of the spine.
Right.
And you can work in a better way. You will have better efficiency and a very long career. So you will not be fraught with all these problems.
Yeah.
Third thing is the nutrition.
I was just going to come to that because that's something we've not covered. Currently, posture, any workout, any he sagal alappan. What is it that you need to give in terms of nutrition to your body and spine?
For the spine especially, you need calcium and vitamin D for the bones. You need good amount of proteins,
yes,
other vitamins and antioxidants for the muscles.
Right.
A machine can be only as good as the fuel that you provide.
Absolutely.
So if you do not have good nutrition, sooner or later you will end up in other problems, but especially the spinal issues. So proper nutrition, regular exercise, proper posture, preventing bad things, bad habits like smoking, drinking, etc., because they tend to affect your spine very badly. Even doing things as your hobbies which puts too much strain on your neck and back all the time. Like I'm interested in photography, but when I sit on a hide or even in the jungles for hours, craning and swooning my neck and back, the next day I get up in a problem.
You have to compensate for these things that you need to do.
Exactly. So I have to work on my muscles much more if I want to do that activity.
Correct.
So that while doing, I will not damage my body.
Correct. And one more habit, jata I want to tell people, smoking, drinking, हे सगळं तर आलंच. But what about sitting on the commode for hours? जाता त्या लोकांसाठी one health tip.
It is a disaster. It's absolutely a bad habit, not just for your spine, for everything. That's not a position you should be sitting. You just get glued to the small screen and it just becomes an addiction. So first and foremost, break the habit. Don't carry your mobile there. Don't keep books over there. It's a daily activity. It's a need, but keep it to minimum and just get out. That's
it. Just get out. Start making that simple change in your routine now. That's all we want to say here. I know that may sound a little compulsive, but guys, जोपर्यंत आपण नाही म्हणत नाही तोपर्यंत मोठे मोठे चेंजेस आपल्या आयुष्यात होणार नाहीत. So just make sure that these little habits which you are now getting carried away with can really hamper your life and lifestyle and health in longer term. That's all from us for today. Take care of your spine. कडा आणि मणका मजबूत ठेवा, स्वतःची काळजी घ्या आणि थँक्यू डॉक्टर फॉर मेकिंग दिस साऊंड अंडरस्टँड व्हेरी सिम्पली टू अस.
It was a pleasure. Thank you.